Because of recent medical advances, the HIV epidemic, it's within reach of ending the epidemic, right? We're so close. The Ohio AIDS Coalition was established in 1989 by a group of concerned citizens. OAC covers the entire state with advocacy, leadership development, and education for people living with HIV.
Hey, this is Zach from OAC.
Hi, Zach. Marie. Hurry.
We have kind of been the community leader and a trailblazer in that aspect of the state. And as a result, a lot of the healthcare agencies are starting to include us in conversations.
No, materials for the talk today.
Oh, I just saw it.
Starting to get a very firm grasp on how HIV affects the community at large, right? It's a public health issue.
The Syringe Exchange Bill, HB 92, House Bill 92, we have monitored it from the very beginning, and it successfully passed through the House of Representatives, and now it's in the Senate. It's in the Medicaid Health and Human Services Committee right now. Right now, we're kind of in the stage where we recognize that a syringe exchange program can be somewhat controversial for communities in which it might be implemented.
Also, transportation is a huge issue in our community. Many of the folks, again, are low income or not working, so any way for them to get their medications easier is better. One of the biggest policy pieces that we're working on right now surrounds the Affordable Care Act and its implementation in Ohio. Two pieces of the Affordable Care Act, right? So one, healthcare reform and the ACA marketplace, and then two, Medicaid expansion.
There's been a lot of interest in just checking in with us as the unfolding of the Affordable Care Act has gone on about just exactly what it means for our community, and so we've been happy to provide the information that we do know, and as well as just kind of feedback about what is and what isn't going so well, and areas of potential advocacy moving forward as well.
So first of all, with Medicaid expansion, about 60% of our clients will be able to access services for the first time in their life other than through the White and White program, which is how they've historically gotten any sort of health care. The Medicaid program seems to be pretty open and inviting to people living with HIV, and we're really happy about that. They're immediately isolated. People are less likely to touch them. People are more likely to use blaming language and assume that they're of a certain class or that they have engaged in some sort of behavior that would cause this. That it's kind of their fault. Stigma is obviously a huge component of HIV, and it's kind of the number one thing that we're always battling, right? We battle that when we work within the HIV community, we battle that when we work outside of it, and we battle it bridging those gaps for the HIV community.